Hello, this is Gary Franke at Achieve Alpha Insurance, giving you a quick overview of the 2022 open enrollment for Washington State. If you have any questions, give us a call or text message at 425-802-2783. This is just a quick overview. Make sure to check the carrier's websites from that perspective. For making an appointment, go to achieve-alpha.com, click on the Health Insurance tab, and click on Make an Appointment. As for other services, we're a full-service insurance agency, so we do life, health, disability, long-term care insurance, auto insurance, and homeowners insurance. We have agents in every line of coverage that are experts in what we do specifically, and we're brokers, so we shop around. For the auto and home, we have about 14 carriers to help you shop around for coverage. Let us know if you have any questions. We run that through our other agency, Base and Pacific Insurance, that we work through. For the Health Plan Finder itself, once you log in, if you have a current application, you only want to click on Report a Change. You do not want to start another application unless it makes you. For messages, the message center is off to the right. Any email or message they will ever send you is in there, so you can always look in there from that overview. For us, adding us as a broker, click the Find a Broker if we're not already your broker. There's no cost for us to help you out. The commission is exactly built into the price, so it's the same for you if you do it yourself or work with us. Put my last name, Franke, in, Franke. Click on Request Help, and any of us in our agency can help you from that side of things. So once you get to the very end and you're actually looking at the plans, it will make you go through the Smart Plan Finder system. It has good intentions, but it's not the most accurate system. Always go to the carrier website to look up your doctors, prescriptions, and the hospital systems you're going to be using. If you're going to filter by, you want to click on the filter by for the carrier or gold, silver, bronze. Here's kind of an example. You have to scroll down quite a bit. So here we're going to look at 3 different carriers, when we're searching through potentially. Click apply, and then you can go through and, look at all the carriers overall. As for the carriers, this year Primera has about an 18% increase and Molina is about 8%. So if you're on a plan, it might be good to look at just kind of the aspect of how much is going up to how much your benefits are. As for tax credits, we're not accountants. We cannot give accounting advice. You need to project what your 2022 modified adjusted gross income is. So essentially, it's all your taxable income from all your income sources is approximately how you come up with that. Accident insurance policies are really attractive, especially if you're going to get a bronze plan that's a little bit cheaper than a silver, but you want to cover the $6,000 or $8,000 max out of pocket or deductible. For a 45-year-old, it's $27 a month for $7,100. These are very attractive. We also sell critical illness and hospital recovery, so if you're hospitalized, it'll cover up to $900 per day you're in the hospital. Prescription drugs, here's kind of a quick overview of Tier 1, 2, 3, and 4, how they are covered. Feel free to pause this as you're going through or go back if you need a lot of prescription drugs and looking at the carriers. The carriers here, you can only get tax credits through the Health Plan Finder. The vast majority of all plans are through this. However, they're also listed in general, like who has generally the larger network down to the little bit smaller network from that overview. Here's a graph of who has the carriers to who the networks are for the hospital. So just kind of giving you an idea, if you have specific hospital networks that are really important to you, this is a good graph to look at. Something really important this year, this is the second year of having the public option. If something says Cascade Select on it, do not select that plan. It is a smaller network, and it's only about 5% cheaper roughly. So always click, like, for example, Ambed or Cascade Silver, not Ambed or Cascade Select Silver. Huge difference in the independent doctor network, same general hospital networks. Cascade Care plans are offered by every single carrier, so they have the same gold, silver, and bronze structure for how their plans look. However, each carrier has their own network, so that's the main thing from that aspect. Anything down below in the green and gray section are covered before the deductible. But if you have a larger expense and you're on the silver plan, you'd have to pay the first $2,000 and then 30% until you hit $7,800 for your cost of things. One of the advantages of Regents is they are covered in 4 different states: Washington, Idaho, Oregon, and Utah. They also just added Virginia Mason for their network for 2022. So they've expanded their hospital network, and they have a very strong independent doctor network. As for plans, we generally recommend the Regents Cascade plans more than their plans that they offer through themselves. They're a little bit more expensive, but they're a lot better plan designs for Regents this plan. Some carriers are better with the Cascade, some are better with their own plan designs. For example, and better, the Bronze Zero Deductible is kind of like a Bronze Plus plan. It's almost like a Silver plan from what it's covering up front, but it has a little bit lower cost for what it is, along with the Molina Bronze as well that they offer. And better has coverage in 25 states, and so if you're going to be living in Nevada, Arizona, Texas, Florida, Illinois, there's a whole bunch of states that are covered for in-network benefit. This can be a very good option for you. Ambetter does have a more moderate network of independent doctors, but it is growing, so they're a good carrier for the price. For 2022, they're adding Virginia Mason for in-network and multi-care. So multi-care has a lot of independent urgent care centers around the greater Western Washington area, so that's kind of an advantage there. As for LifeWise, LifeWise is owned by Premera, but they have a more skinny network of hospital systems they offer. A very similar independent doctor network, but they're a lot cheaper for the price. If you need to see a counselor, mental health doctor, a psychologist of sorts, you want to choose a Premera, LifeWise, or Regents plan. They just have a much better network of psychologists than Ambetter and Molina and Kaiser for the most part for how they structure things. So LifeWise has a more slim network of hospital systems, but they're very good plan designs. We generally recommend the Cascade LifeWise plans. For the price, they're generally a little better value. Premera has the most hospital systems and the most doctor networks. However, this is not the Premera PPO from an employer network. It's a Washington State only network, like LifeWise is as well. So make sure to look up under the individual signature network if you're searching for Premera. So it covers most of the things as the group plans do, but they're also the most expensive. So if you have a Premera plan, it might be good to look at a LifeWise or a Regents plan for the cost, but if your doctors are only covered under the Premera one, then that's the best option for you. Molina Marketplace, they have a huge network of hospital systems, but they have a fairly small network of independent doctors. If you're only going to, for example, Overlake, then Molina is a good option because they will cover Overlake doctors. But if you need to see a dermatologist or psychologist, a lot of times Molina is not the best option. They just have a smaller network, but they're also cheaper plans. So their Bronze plan is fairly effective as well from that perspective. Kaiser Permanente is one of the more lower cost plans, but you can pretty much go to Kaiser Permanente HMO core network. It's not the PPO network. So they can be a good option depending on what your needs are, but they do have good managed care. They are very cost effective. United Healthcare is a second year back. They have a more modest network of independent doctors, and they have an okay network of hospital systems, but they're really expensive for the price. You can get a LifeWise or Ambetter plan a lot cheaper, or even Regents. Health savings account, if you're going to have a major surgery, a very large expense, getting a Bronze plan is so much better than getting a Gold plan. If you're going to hit your max out of pocket, it's more effective for most people from that aspect of things. We sell the cost share plans. If you can't afford or don't want to buy a more expensive fully comprehensive plans, we sell the cost share plans. They're not insurance. They don't cover pre-existing conditions. They only cover new medical issues. They can be an effective plan for the price. They're more affordable from that aspect of things. We'll go over those in more detail if you need to. For dental insurance, we recommend adults to go direct to the carriers. For children, if you're going to use more dental coverage, dental insurance through the Health Plan Finder is so much better for children under 18. However, it's more expensive than the direct plans. So there's a balance there with anything, but that's kind of how dental insurance works. Emeritus has a 6-month waiting period for major like crowns and root canals, but for the price, it's a lot cheaper than Delta Dental. For their in-network dentist is probably about 70%. They also have an Any Dentist network, which is a little more expensive, but they're still cost-effective compared to Delta Dental a lot of times. If you're just buying a Delta Dental plan, they have a 12-month waiting period for major services. However, if you're coming from an employer plan or previous dental plan, they waive that waiting period if you can, show that you had prior coverage before. So in conclusion, if you have any questions about plans and options, you can give us a call or text at 425-802-2783.